Hi, everyone, and welcome to this extra special episode of the Hillingdon Hospitals podcast. My name's Adam Tocock. I'm your Library Services Manager, and today I'm joined by Louise Cave, who many of you may recognise from previous episodes. Louise, would you like to introduce yourself for those who don't?
Hi everyone. My name's Louise Cave. I'm Operations Transformation here at the Hillingdon, and you'll probably recognise me from all of the Cerner work and rolling that out to you all.
Excellent. Thank you, Louise. So, welcome back, and cheers for talking to us today. So, today, though, not entirely talking about Cerner, we're talking about something else because we recently purchased a book for our collection which features a chapter authored by your good self. So this is the book here, Harnessing Digital Technology and Data for Nursing Practice. So I guess the first thing to say is well done there, Louise. Can you tell us about this book then and how you came to write a chapter in it?
So it was a very, very exciting opportunity. So probably was first approached about 3 years ago to contribute to this chapter in the book. And so it feels like a bit of a lifetime ago now. I was working in Manchester at the time at a hospital up there and was leading at the time. I was the chair for the National Shared Decision Making Council for Nursing. Now, these national shared decision making councils were set up through the COVID-19 pandemic by the CNO team for England. And what they wanted to do is set up these councils that had people from across England and used a collective leadership model to sort of gain insight at a national level as to what was going on the ground. And so I ended up chairing the digital one for nursing. And so that was back in 2020. And so then come 2021, um, they'd been really successful and we'd gained lots of insight from them through the COVID-19 pandemic. We had lots of opportunities to even write up things that were going up to Parliament and, influence change at the highest level through the pandemic. Um, and so then I had this opportunity to sort of get involved in a book chapter and sort of look at the experience that I'd had and talk about the principles of collective leadership and bring that in and talk about why that's important through digital transformation.
Lovely, thank you. Sounds very interesting. So you've teased my next question a bit there. I was going to ask. So can you tell us then a bit about your chapter in particular and the kind of the theory that's front and center behind it?
Yes. So my chapter is titled Leadership for Successful Digital Transformation. But the sort of body of the chapter is more about collective leadership as an approach to leadership design and change, which is really lends itself nicely in digital transformation. I always tell people when you think of collective leadership, think of a time that someone did something digitally and you weren't sort of involved in the process, you didn't know it was going on. And hopefully none of you will think of the Cerner program because hopefully you will feel like you've been involved and informed at every stage of the process and had an opportunity to feed back to me at different points. But equally, that's historically how a lot of IT projects were done throughout the NHS, where suddenly you'd come to work one day and the whole thing would have been changed. And so collective leadership was really born out of this whole it's a leadership model that kind of looks at how you can involve people and it stops that top down authoritarian leadership style. It's a very bringing everyone on the journey type of leadership style. Um, and so that's what I wrote my chapter about, is how you can actually use that to change and do digital transformation in a local hospital across a piece of work, but also that how that could be used then even, as I said, at a national level where you're looking at bringing lots of people together and use that to influence policy at a national level. The joy and I think the absolutely amazing thing about collective leadership is, and what I found so empowering, is it really doesn't matter who you are when you're um, doing any kind of form of collective leadership. The whole point of collective leadership is that actually you as an individual, if you have an opinion on it, then it that's what matters, and that's what's part of the process and flow of how the change happens. There's no one going out there saying, oh well, it's all for band 5s and above or band 6s and above. But some of that rhetoric that sometimes you get in different projects and processes within the NHS.
Yeah, so thinking of one in particular, one project in particular, then taking it back to us here at Hillingdon. So how did you use this leadership model then when you were making that happen, when you're getting Cerner going here?
So yeah, I mean, I joined you here at the Hillingdon quite late on in your Cerner program. So I joined actually May last year, which I mean, it's over a year ago, but it was quite late on in the program, in the build up to it. So lots of things, process had been already established of different groups with people and the way they're working. But I sort of because I've written about this and really believe in this as a leadership style, you'll notice in the ways that I work. So every time that we've had sort of a group around an issue, I'll make sure that we're pulling together everyone who is part of that process. So I'm a big believer in that. Then if you look at with collective leadership, if you then use your systems thinking of saying, where is everybody in the system, where is everybody on this process, that you can't do one change without talking to someone about the impact of that change on them and what that knock-on process is. So that was sort of how I've sort of tried to bring that in here at the Hillingdon, especially in this post go live phases, actually, as we're sort of setting up what we want the process for sort of Cerner optimization to look like here at the Hillingdon, having some of those really key principles rooted in it, where we can sort of say, oh yeah, we can use collective leadership here, we can use different groups, different reporting to sort of pull out some of those bits. And actually, I always tend to find if you do it well and you do it effectively, you get to know about things that you would never have expected to know about before.
Yeah, well, have you uncovered anything in particular? So my next question was actually going to be like, you've got within the chapter, there's like learning exercises. I think that's what they're called. Yeah, just which poses like readers some questions that they can consider. So one of them is one of the 7 critical success factors for excellence in digital transformation asks. So it mentions what good looks like for nursing framework. So what I wanted to ask was like how are we doing in terms of that here at Hillingdon? We looking good?
Yeah, so we're doing really well on when it comes to what good looks like. The exciting part of it is I also was around when after my job in Manchester, I then worked for NHS England for a bit and helped them write some of the what good looks like for nursing. And so the chapters very much align in that's a policy document that was influenced by me and we helped to write. And then we wrote the chapter, and I've done the doing. So look, what good looks like for nursing is just like there is a policy document that's called What Good Looks Like for Hospitals and Digital and Data that was originally produced. And then we looked at specifically what does that mean for nursing? So around your critical success factors like well-led. So for example, in this organisation, we have got really good digital nursing leadership. Our chief nurse, Sarah, is really involved in the digital programme, but we've also got Ranjit, our CNIO, who reports directly into the nursing programme. She's really involved with the nursing teams. But then we've also got digital nurses out in the wards who will pop out and see people. So we've got Brenda, and we've got Sarah who will go around and pick up any of those digital things. So we've got a really well-led programme when it comes to nursing that just sort of starts to really pull on some of those success factors. There's still some bits to go, and Ranjit would definitely be the first one to admit that there's lots of little bits of nursing that still need to go and develop. But Cerner is our foundation block, having an electronic patient record. If we didn't have that in place, there was no way we were going to get to those 7 success factors. But we've got the well-led, we've started to get the data because everyone's putting it in now, and that will lead us on to have all of those aligned. And so then will be a really successful program.
Nice. So we'll have to get Ranjit on to give him the right of reply. That sounds good. So I guess the final question I have is because you mentioned that you've got an iron in the fire you've got like a new project coming up, a new chapter, some more writing. What's happening?
Yeah, so I've got another chapter that I've been asked to write, and this one's a bit of a different one, and this comes out of some of my previous work as well. So one of the things that I sort of said that I think it's important to talk about whenever you get asked for these opportunities, it takes time. So when I was asked to write this chapter, it was back in 2021, and then it wasn't published until the beginning of this year. So you can kind of see it was a long old process before it got published. And in the in between stages, if you look. If you happen to take the book out and you'll see that there's a professor on there, Aaron Jones, and he was based in Sydney. So I did have to do lots of like early morning calls with him just to really get that international input. But I've just been asked to. I was asked in the beginning of this year to write a chapter on the future of nursing, with AI and surgical robots and sort of emerging technologies. And so currently looking at that and writing that with a professor from Salford University. I'm working on that closely with them, and I'm also working with a professor from a Canadian university on that. So the professor in Salford, he approached me and said, I'm writing this book. Well, I've been commissioned to write this book. I would like you to write a chapter. And that was because I'd done some research and it had recently been published around the use of artificial intelligence within nursing. And so then he said, I'd love you to write this sort of future of nursing piece with me for the chapter. And I said, what I've learned is actually it's all well and good writing something with two people from England, but it's not widely sort of replicable. We tend to get very stuck in our own NHS bubbles whenever we talk as two people from England about it. And sometimes, we even get stuck just talking about NHS England. So it doesn't apply to Scotland, Wales, or Northern Ireland. So we pulled in a colleague that I'd met from Canada, and she's a mental health nurse out there, and she works as a CNIO, but also she's a professor. And we've been unpicking it and looking at what the future of nursing might be. But again, so I had my first draft of my chapter in for that in March, and I've got some revisions that are due by the end of August. And then I don't expect the publication probably until sometime next year. So it's a bit of a long old process, but it's exciting.
Yeah, that sounds really cool. I guess any advice you could give to people who are embarking on the same authorial roads would be to have a bit of patience amongst it.
Yes. So I think that's the thing. Like sometimes when someone says to you, would you like to write a chapter? It needs to be 2,000 words on this subject. The first thing you'll think, oh, am I the best expert to do this? And you'll probably get a bit of imposter syndrome. But you just have to sort of realize that that person has asked you for a reason. They've not gone sort of like down a phone book and just picked your name and said, will you write the chapter? And if they had done that, you'd have known in an instant. But they're asking you for a reason because you've got some sort of knowledge on the matter, or they've read something that you've written already and think, actually, I think this person can expand on what they've already written. So put your imposter syndrome at the door. I always have to do that. I think everyone gets it, but you just park it there and say, right, I'm meant to be where I'm meant to be. And then it will always seem like, to begin with, you're like, oh, 2,000 words on this subject, that's quite a lot. Where do I start? Then you'll get to the stage where you've suddenly written 5,000 words on the subject, and you'll think, how do I get down to 2,000 words on the subject? So it's a real process. But you always are given quite a long period of time to get this done by, and if anyone's really rushing you for it, that's when you have to sort of really sort of step back and think, oh, is this the right thing for me if they're asking for this for within 1 week? And if you're not used to that type of thing, most books are the way that they're commissioned through the different publishers, especially if they're sort of that academic style, they will sort of take about a 2-year cycle to be published. So you should have time to sort of write a draft, get some feedback, and then come back to working on it, and then go through those cycles. And I would always say, just whenever you're approached about these things, if you think you need support doing it, or you think someone else's opinion in the writing of the chapter is going to be worthwhile, that's where you just got to look around you and think, what do I need? How do I build this team? Being an author could be a really lonely place, but for me, so far, I've had lots of lovely evening phone calls to Canada, where my Canadian colleague likes to show me all of the, through winter, beautiful snow and just absolute pristine landscapes. And I'll show her nice grey, wet, dreary London, and really boosts your morale. And you think, oh, I'm in the right place. But it's a good thing to just, it should be something to enjoy. It shouldn't be something that's stressful. You're sharing knowledge. You don't have to be the biggest expert in it. Pick up on people's opinions. This current chapter that I'm writing is not something that I'm necessarily an expert in, because nobody's an expert in the future. It's very much looking to sort of the landscape and thinking about the current technologies and where we might go with things. So that's kind of exciting in its own sense. Whereas the previous one, I'd lived and breathed collective leadership. I'd done it. And so I felt like I could, really add that narrative of someone who had been doing it, who knew what it felt like. From being like a band 5 staff nurse to someone who had gone up through and worked for NHS England and done it, I'd got the range of experience, so that felt quite good with that one. So what I would say is just, seize the challenge and, don't keep the imposter syndrome at the door, and pull in a team around you. And, as long as you plan nicely, give yourself, write 250 words one week or write 500 words one week and then get back to it in a couple of weeks time and do a bit more editing. It's really, really manageable. You shouldn't just think, oh, I'm gonna have to sit down one day and write 2,000 words. If you're doing it well, then you're plodding it out. Trust me, you'll end up being like, oh, I've only got 2,000 words. And that'll be your biggest challenge, and you'll be cutting down words and thinking, well, this sentence is so important to me.
Tell you what, I feel like writing a book chapter right now, Louise. After that, I feel like I've got a chapter in me. I've got a book in me. It's great stuff.
Absolutely.
We've all got one in us, or several. I should say as well, just to add to what you've said there, what we I guess what we lack in beautiful snowy vistas, we make up for in the best darn library services in town. So if you're looking for the research that you'd need to inform any upcoming research or chapters, library service are here for you. Yeah, so whatever the specialty, let us know. Rami and myself will be very happy to help.
Well, I think that's really important, Adam, actually, like pulling your library services in as, they're part of your team as well. Chat to them about it. If you've got given a project about these sorts of things, or you've signed up to author a chapter, don't think you're by yourself, or you have to invite 100 different people. Start close to home and just say to people, look, I've had this amazing opportunity, how can you help me? Never be afraid to reach out and ask for some help on these things. There's loads of people like you, Adam, who are willing to help people with these things.
Quite right. So we'll be looking forward to hearing from you, people out there, wherever you are. So we'll leave it there. Thank you, Louise, on that positive note. Very appreciative of you taking the time to talk to us. And everyone, if you'd like to have a read of Louise's chapter and several others, we've got the book here, Harnessing Digital Technology and Data for Nursing Practice, available to borrow from us here at the library. But that's all from us for now. We'll leave it there. Thank you very much. Thanks, Louise.